Good evening and welcome to another episode of Easy Access to Healthcare for All, a program sponsored by the National Health Insurance Scheme to give you information about the scheme, news updates, as well as explain issues around the NHIS. In this episode, we bring you an insight into the various programs designed by the NHIS to provide a healthcare cover for Nigerians, irrespective of their standing in society. I'm your anchor on the program, Firdausi Ahmed Wakili. Sit back and watch as we unfold the program to you in a moment. First on the program is a highlight of events around the NHIS. Our top story is the signing of a Memorandum of Understanding between the National Youth Service Corps and the NHIS. These and more stories coming up shortly.
The National Youth Service Corps on Tuesday, 7th September 2021 signed a Memorandum of Understanding with the National Health Insurance Scheme (NHIS) on the inclusion of corps members in the scheme. During the signing of the MOU at the corporate headquarters of the NHIS, the Director General of the NYSC, Brigadier General Shuaibu Ibrahim, said the MOU was in line with President Muhammadu Buhari's directive that all corps members be enrolled into the scheme. General Ibrahim, who thanked the NHIS for this partnership, added that the partnership will cushion the health needs of the corps members in their different states of service.
History is being made, and I know what it takes as a historian for this opportunity given to us by the President to enroll our corps members in this program. It's an indication of the concern of the federal government for the welfare of corps members, and also an indication that the federal government also appreciate what the corps members are doing. I'm happy that all of you are retired corps members, and you can vividly remember with a joy or nostalgia your service here to our dear country. I want to use the opportunity to thank you all for your service to the country which you rendered during your service here.
On his part, the Executive Secretary of the NHIS, Professor Muhammad Nasir Sambu, said every Nigerian should be included in the healthcare delivery plan of the federal government. He expressed the hope that the law will be reviewed to make the scheme mandatory for all Nigerians.
As it is currently, the law establishing the National Health Insurance Scheme is not mandatory. And anywhere in the world where a universal health coverage is realized, you realize that the law establishing the health insurance is made mandatory. But unfortunately, ours in 1999, when it came out, it was non-mandatory. But we have worked assiduously in collaboration with the National Assembly, and that law has been reviewed and awaiting presidential assent. By the time we have the President assented to the bill, we will now have a very clear pathway for attainment of universal health coverage.
Professor Sambu admonished corps members to take the enrollment process seriously.
So what is left for the corps is to reciprocate the government gesture by ensuring that they dedicate themselves and commit themselves to the national service. At one point or the other, we were all corps, and we have been able to perform our stewardship role. So we will call on the corps to reciprocate this gesture of the government by ensuring that they rededicate themselves to the national duty.
The climax of the event was the signing of the Memorandum of Understanding between both parties. A corps member serving at the NHIS corporate headquarters expressed the excitement of the corpus being carried along in the scheme.
We feel very excited. We are very happy. At least it's an opportunity for us to visit any healthcare organization, any health facility, to just say we are corpus and we need medical treatment or assistance, and be rendered, and to be rendered to us. So it's a very big opportunity for corpus.
Free healthcare, free treatment, free every other thing. At least, if I thought that you pay, it will be minimal.
Chida International Hotel in Abuja played host to 6 newly accredited health maintenance organizations, HMOs, for an orientation workshop organized by the NHIS. The workshop, which took place on Thursday, the 9th of September 2021, had in attendance the Executive Secretary of the NHIS, Professor Muhammad Nasir Sambo, and other management staff of the agency. The orientation workshop saw the induction of 6 HMOs. They are Bastion Health Limited, Hallmark Health Services Limited, Newage Healthcare Limited, Century Medicaid Services Limited, Royal Exchange Healthcare Limited, and Rothauge Healthcare Limited. In his welcome address, the Executive Secretary, Professor Muhammad Nasir Sambo, said the HMOs to be inducted have been found worthy to be part of the scheme. He also said the event is significant to the attainment of President Muhammadu Buhari's Sustainable Development Goal agenda, which is to ensure that nobody is left behind in the process of getting quality healthcare. Professor Sambo also added that enrollees are beginning to gain confidence in the scheme, stressing that the NHIS will deal with elements within that want to sabotage the scheme.
The ecosystem or the NHIS now is now very, very keen in tracking whatever is happening within the ecosystem, and NHIS don't hesitate to make any punitive measures that is within the provision of the guideline of the NHIS for any actor within the system that has gone against any of the provision of the act. So I implore you to go back and read all the documents of the National Health Insurance Scheme, including the newly developed 10-year development plan and the 1-year giant stride activities that we have done in the process of reform, as well as other documents that we have developed, so that you be well acquainted with the way and manner you handle this enrollees.
When the need arises.
At the end of the workshop, only one of the accredited HMOs, Bastion Health Limited, was issued an accreditation certificate. The other 5 HMOs were given 1 month ultimatum to clear their issues of indebtedness with their healthcare facilities before they will be issued their certificates, or risk losing their accreditation at the end of the 1 month grace given. The Executive Secretary and other management staff of the NHIS spoke on the matter.
Okay, you know, in the new NHIS, reformed NHIS, we disqualified or we remove the accreditation of those who could not fulfill the criteria, and we give them moratorium where they will wait and reapply fresh. So some of them have reapplied fresh, and they are coming into the system as if they are coming newly. But because they have some backlog of debts that they incur while they were in NHIS ecosystem, we look into the matter and ensure that they must settle all those debts before we give them the certificate.
For transparency and accountability, NHIS has done a publication and say we are about to accredit these 6 companies as HMO. So if they are owing you, please write to us. So for those 5 HMOs that were not giving their certificates today, they were letters from hospitals in different parts of Nigeria saying this company is owing us.
We've set standards, and you have to meet up those standards. Standard accreditation standards, accreditation of HMOs, accreditation of providers. We have standards in everything. So whoever is a stakeholder within the industry, you must fit yourself where your standards are and make sure you abide by whatever that is set for you.
Representatives of some of the HMOs also had this to say.
It's good that we pass through this induction. It's an eye-opener. You saw the kind of training we all had to go through before we are given the certificate.
Usually when an HMO is coming on board, it's normal to just, get them familiar with, what the scheme entails, and let them know all the processes so they can't say they have not been told. So, doing the organization workshop is good, it's a good development, and it's very, very important.
The program is easy access to healthcare for all. bringing you news and issues around the National Health Insurance Scheme. The NHIS has been created and designed to provide social health insurance in Nigeria, where healthcare services of contributors are paid from the common pool of funds contributed by the participants of the scheme. What are the various programs of the NHIS? Who are the beneficiaries? These are some of the things we shall be finding out in our next segment, Issues Around the NHIS. Stay tuned.
Every human being has the need for healthcare at one point or the other. Sometimes they pay from their pockets. With the National Health Insurance Scheme, things are different. Persons enrolled enjoy healthcare without having to worry about payment. In order to ensure that every Nigerian has access to good healthcare services, the National Health Insurance Scheme has developed various programs to cover different segments of the society. These programs cover the formal sector, the informal sector, and the vulnerable group. The Formal Sector Social Health Insurance Program (FSS-HIP) is a social health security system in which the healthcare of employees in the formal sector is paid for from funds created by pooling the contributions of employees and employers. The formal sector consists of the public sector, organized private sector, group, individual and family social health insurance program, GIFSHIP.
One, you have what we call the public sector, especially those with the federal government employment. And we have organized private sector, companies with 10 staff and above that want to enroll their staff within the scheme. That provides a platform for them. We equally have an innovative program we have designed, we call the GIFSHIP, the Group, Individual and Family Social Health Insurance, which we think is what we use to give those Nigerians that are not actually within formal employment to come into the scheme, as our mandate is to see that nobody is left behind.
For the public sector program, the employer pays 3.5%, while the employee pays 1.75% of the employee's consolidated salary. For the private sector programs and other tiers of government, the employer pays 10%, while the employee pays 5%, representing 15% of the employee's basic salary. However, the employer may decide to pay the entire contribution.
We don't just move into the street and begin to cover people. It's a contributory scheme, and we cover based on those people that make contributions. Our contributions are made on their behalf. If you look at the category of programs we have mentioned now, you will look at clearly that this department is a contributory. In fact, it's made up of those programs that are contributory in nature, as against the other ones, which is a subsidy program.
The second program of the NHIS is the Informal Sector Social Health Insurance Program. It is a social health security system which is designed to cater for the healthcare of persons under the informal sector of the economy. It covers employees of companies employing 10 or less people, artisans, voluntary participants, rural dwellers, and others not covered under the formal sector. The Informal Sector Health Insurance Program is further categorized into 3 forms. These include the Basic Healthcare Provision Fund, Tertiary Institution Social Health Insurance Programs, vulnerable groups. The Basic Healthcare Provision Fund was conceived to cover all Nigerians.
But I must say that priority for this group is given to those that are indigent. In other words, if you are a wife of a person who earns reasonable income, you are pregnant, we are not expected to cover you. If you are a child under 5 and you are the child of a governor, we will not cover you simply because you are under 5. So you have to be indigent. That means you have to be poor and incapable of paying for yourself, for your healthcare needs. So those are the targets. So beyond that, any other indigent person, you could be able, but you are unable for some reasons to earn enough to take care of yourself. We also cover you. We have the T-SHIP program, which, like I had said, is a tertiary institution social health insurance scheme that covers students in tertiary institutions like polytechnics, universities, maybe nursing, training schools, and things like that.
Vulnerable Group Social Health Insurance Program is designed to provide healthcare services to persons who, due to their physical status, including age, cannot engage in any meaningful economic activity.
Then we have the vulnerables, which is some select group like prison inmates, IDPs, that's internally displaced persons, trafficked persons, migrants who may be running away from other countries because of one problem or the other. We also, on that division, handle the aged, retirees. They come under that segment of vulnerable group.
While the formal sector social health insurance program is contributory, the Basic Healthcare Provision Fund is fully funded by the federal government. Another point to note is that, unlike the formal sector social health insurance program, which covers an employee's spouse and 4 children, the Basic Health Provision Fund only covers the registered individual.
If you are registered, it's only for you. It doesn't cover your children. It doesn't cover your spouse, even though we expect that if it is a man who is considered indigent or belonging to the target group, obviously it means that the children, and if he has a wife, will also be indigent because it's one family. So they will all be registered as individuals.
With the various social health insurance programs designed by the NHIS, it will not be wrong to say that the informal sector social health insurance program is for every Nigerian.
By these different programs targeting different segments of the society, we are on course to achieving universal health coverage, especially as it concerns equity, where we say nobody should be left behind. Those who can pay should pay in the contributory schemes like the gift ship, the formal sector program. Those who cannot pay, government should pay for them, or philanthropists should pay for them, as it were.
Welcome back from that timeout. Easy access to healthcare continues with our stakeholder segment. On today's episode, we had a chat with Dr. Adeyeye Jimmy, the president of the Healthcare Providers Association of Nigeria, HCPAN. HCPAN was formed in compliance with the Act setting up the NHIS, and it acts as a mouthpiece for all healthcare providers in Nigeria. Dr. Adeye agrees that the NHIS has helped improve healthcare provision in Nigeria as it gives providers a little extra funds through payment of capitation.
If you have a good number of enrollees and you are giving substantial capitation that can prepare you in advance in improving the status and standard of a facility, and that capitation being paid on time, and if it is not carpeted by inflationary trend, you can use it to procure hospital equipment to some extent. Even it can just serve as a buffer to what you are budgeting, because it's not only that category of patient that we see for now. We are probably waiting or awaiting the time we have universal health coverage. But for now, we can still buy our sphygmomanometer, buy the microscope and small things that we need in delivering health care from the capitation.
On their part as providers, Adeye says HCPAN has been working with the HMOs to improve efficiency in the NHIS.
We are working on a conjugal relationship, bilateral relationship between the HMOs and providers, so that if the two of us understand each other, no one will be feeling cheated or no one will be feeling shortchanged. It is painful when a particular stakeholder feels that the other person is doing sharp practices or is undermining your own kind of business, for example. So what we are trying to do now, we've called for meetings, we've called for consultations, we've called for discussions among providers and HMOs. It is when two of us work well that will lessen the burden of the regulator. And at that level, it will be a win-win situation. When the regulator sees us that we both understand the language of the business, their burden is lessened. And the idea of saying, oh, our journey to universal health coverage will be far, will not be entertained. We all work towards accelerating universal health coverage.
Dr. Adeye says as healthcare providers, they have a major responsibility to enrollees for the overall well-being of the nation.
We need to care for the enrollees. We need to attend to listen to them patiently and attentively, to show empathy, to show concern, even where they have financial issues. For example, if there are areas where people still co-pay, where they still have to take something from the pocket to subsidize, we have to educate them on why it can ever be like that. For example, the 10% co-payment they need to pay in pharmacies to obtain their drugs. We have to educate them on why that is being done. Is to prevent abuse of the scheme, so that no Tom, Dick, and Harry will just come. And then to have to let them know that even though you are under health insurance, we still allow this co-payment in order to regulate what is happening beyond abuse. So some of our duties we do, some of us have set up something like enlightenment or educational unit in our practices where people come. So we have what you call public relation units, where people are sat down, you are welcome, you are given water to drink to calm down your tension. We educate you, we open space for you to ask questions on where you are not clear. I also want to have feedback from them. We create suggestion box, we create website, we create their WhatsApp, we create other social media, they can feed us back.
That was Dr. Adeye of HCPAN speaking on what healthcare providers add to the NHIS and particularly to enrollees. Coming up next, your question answered.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
Question: do pensioners contribute to NHIS?
The pensioners and the elderly are a very important aspect of our population that we are interested in. NHIS is developing programs to capture the pensioners. Many of them are already enrolled under NHIS, like the pensioners for the military, the Navy, the Army, the Air Force are already on board. The police are currently being enrolled. Some of them are already accessing care. The ones for DSS2 are already also being enrolled. They are already enrolled. Some are accessing care, some are still being enrolled.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
This is where we draw the curtains on this episode of the program. If you have questions or comments, please send them through any of our contact mediums on your screen. Join us again, same time, same station on another episode as we continue to bring you more stories of happenings around the NHIS. See you next week.